7:46 down. Dr. Kristen Simpson with Simpson Dental Associates is here to answer your questions about your teeth. And when we wait for some calls, let's talk about what are some of the options for people who are missing their teeth.
Okay, yeah, if somebody's missing a tooth, there are several different ways to replace missing teeth. You can do it with an implant, which is, of course, the best option because the implant replaces the root of the tooth, preserves the bone in the area, and then also replaces the crown of the tooth. Another option would be a bridge. A bridge would connect to the teeth on either side. However, it's then, a three-span type of restoration. So if something happens to one tooth, you could lose the whole span. Or there's something removable, like a partial, that you would take in and out. So those are different ways to do it. And of course, you could do nothing, which we see people do a lot with back teeth, but that's definitely not the best way to go because if you don't replace a missing tooth, the other teeth shift, it affects your bite, so it's always best to replace teeth.
And one thing that comes into play there, I'm sure, are dental implants. What are some of the best ways to use those?
Yes, well, dental implants, there are lots of different ways that you can use them. You can use them to replace a single tooth, like I was just talking about, or you can use them to replace multiple teeth, like in a bridge manner, or you can use them to connect some type of prosthesis too, like your dentures, which we often talk about, placing the implants on the bottom and connecting, your dentures to it to secure them.
And you guys have lots of seminars on those, and we always announce those. Let's go to the phones now. We've got a call from John. John, good morning. What's your question for Dr. Simpson?
I'm in the procedure of getting 6 lower teeth pulled. Was in question of how much healing time am I looking
It's a great question.
Yeah, well, when you have teeth pulled, it depends on, if they're in the front, they just have a single root, so they tend to heal quicker. If they're in the back and they have multiple roots, sometimes it takes a little bit longer for them to heal. It can take up to a couple months for you to get complete healing of the bone in that area. Normally the tissue will close over within a couple weeks, and then, it just depends on what your plans are for replacing those missing teeth with what you want to do with the next step as far as making something removable, or if you wanted to have implants placed, you should do it at the same time that you're having those teeth taken out, as long as there's not infection in the site.
All right, that's a great question.
Yes.
One thing, let's talk about a little bit, coffee or tea? Which is better for your teeth? They're both kind of bad, right?
Yeah, they both can stain, so it really doesn't, either one, as long as you are only drinking it, a couple times a day and not sipping on it throughout the day.
Which is what I do every morning. That's not good.
Yeah, that's the problem most people have.
All right, let's go back to the phones. We've got a call from Monique. Monique, good morning. What's your question for Dr. Simpson?
Hi, good morning, Dr. Simpson.
Morning.
I suffer with seizures. I have epilepsy, and I seize in my sleep a lot, which has caused my upper teeth to protrude out in space. And I was wondering if there any type of dental procedure or something I could get done that's safe for me to help me, align my teeth back.
Yes, there are several options to align teeth. You can do it with conventional braces, the silver braces. You can do it with ceramic brackets. You can even sometimes use the brackets that are bonded on the inside of the teeth, or you can use Invisalign. Invisalign are the clear aligners that help to move teeth that you just wear, pretty much throughout the day. You take them out when you eat, and every 2 weeks you get a different set of aligners.
That's a great question there.
Yeah.
All right, Dr. Simpson, thanks for coming in today. I appreciate it.
Yes.
We're going to take a quick break. There's still more news straight ahead right here on Fox.